All right, so now let's take a look at how we can use the same massage technique to work on the posterior shoulder, because that is typically where, if you had rotator cuff repair or a subacromial decompression, those muscles tend to get guarded and restricted. If you think about it from a neurologic perspective, when I'm reaching up, the muscles in the front of the shoulder are pulling on the humeral bone to get the hand up overhead. These guys have to be relaxed in order to allow me the range of motion to reach up above shoulder level. Well, in a normal painful shoulder, as I go to reach up, pain will trigger a response in the posterior inferior shoulder to pull back down, because my brain knows if I reach up it hurts, so the way to stop the hurt is to pull that arm back down. Once we've addressed the pain, there's still going to be some reflexive response in those posterior structures, inferior structures, to keep the hand down. So we want to just inhibit, retrain the nervous system to allow us to move in that way. So what I'm going to do is I'm going to put the ball right in between, kind of in the crook of the armpit here. I'm going to massage through the latissimus. I'm going to massage through the teres minor, teres major, maybe even a little posterior deltoid, a little bit of tricep. I lean into the wall, and basically all that I'm doing is I'm just relaxed. Again, the arm is hanging, dangling. Think of your pendulum exercise. And while it's in that position, I can do circles, I can go up and down, I can go side to side. I can just sit there. I can also maintain this position while I do a posterior capsule stretch. So now my non-involved side is bringing my arm across, and I'm applying pressure into the sensitized tissue. I'll do that for about 1 to 2 minutes, multiple times a day, just to give my central nervous system the repeated exposure it needs to retrain and start to relax the normally tense, normally guarded musculature. Now, in the last video in this series, we're gonna do the rhomboid muscles. I'll see you there.